Now let's talk about the classification of cocci. So we can classify them into gram-positive cocci and gram-negative cocci. For the gram-positive cocci, please remember GC, which is gram-positive, is for catalase. So it can be catalase positive or it can be catalase negative. For catalase positive, we just have staph or staphylococcus, and for the catalase negative, we have streptococci. Now let's talk about the gram-negative cocci. So in the gram-negative cocci, please remember NM. N is for Neisseria, M is for Moraxella catarrhalis. Neisseria has further two types, which are Neisseria gonorrhoeae, which causes gonorrhea, and Neisseria meningitidis. For the Moraxella catarrhalis, it is a normal flora. Okay, now let's talk about mycobacteria. So all of the mycobacteria are acid-fast, which means that the cell wall has mycolic acid, and they are of two types, which are typical and atypical. For the typical ones, please remember that they are going to cause TB through Mycobacterium tuberculosis, and also Mycobacterium bovis, which is present in cow milk, is also a type of typical mycobacteria. And for the atypical mycobacteria, please remember Mycobacterium lepri, and it is a photochromogen. Now let's talk further about the Streptococcus pyogenes. Streptococcus pyogenes is basically bacitracin sensitive, so it was a type of gram-positive cocci and it was catalase negative. Now let's talk about Staphylococcus aureus, which is catalase positive and gram-positive as well. So Staphylococcus aureus can be coagulase positive or it can be coagulase negative. If we talk about the coagulase positive one, then we have Staph aureus. And for the coagulase negative one, we have Staph epidermidis, which is a normal flora, which is present on the blood agar, and it causes left-sided endocarditis if it enters the blood, and it is novobicin sensitive as well. And now let's talk about Staph saprophyticus, and it is going to cause UTI in females. If we talk about the coagulase positive ones, then we just have Staphylococcus aureus. And Staphylococcus aureus is going to cause right-sided endocarditis. And right-sided endocarditis can also be caused by Candida. Mycoplasma is the only bacteria without cell wall. Now let's talk about Streptococci again. So if you remember, Streptococci was catalase negative and gram-positive. It can be divided into further three groups, which is alpha hemolytic, beta hemolytic, and gamma hemolytic. For alpha hemolytic, we have PV, which are Streptococcus pneumoniae and Streptococcus viridans. Streptococcus pneumoniae is very common and it can be acquired through community. Streptococcus viridans is a normal flora which is present in the oral cavity. To talk about the beta hemolytic form, then let's further talk about the Lancefield classification of the cocci. This is a grouping of beta hemolysis. We have further three groups, which are group A, B, and D. For the group A, please remember that the most popular is the Streptococcus pyogenes, which is going to cause rheumatic fever. And for the group B of the beta hemolytic Streptococci, please remember that we have Streptococcus agalactiae, which is going to cause neonatal meningitis, and it is bacitracin resistant, and it is also going to cause septic abortions. For the group B, we have Enterococci, which are going to cause UTI.